Thank you for that very warm welcome. Like she mentioned, I am Whitney Hightower. I am, let's see, shoot, might need to be over there, I'm not sure. Okay. I'm Whitney Hightower, I'm the outpatient dietitian here. So I meet with everyone who's not admitted to the hospital, essentially. And I work with a wide variety of patients, from pediatrics to the most senior among us. My youngest patient has been 5, my oldest 98, so it really runs kind of the gamut. One of my favorite groups of people to work with are women with PCOS. I find that this is a population of people who are really anxious for answers. They want to know more information. As you may know, if you yourself have PCOS, it's a topic that is largely not understood, right? There's a real need for research. And so tonight's presentation is an effort to fill in some of those gaps and to clarify some myths, and we're going to walk through that.
Yeah, thanks everyone for coming tonight. My name is Kaitlyn McCarthy. I am the clinical nutrition manager here at MCH, so I see both inpatient and outpatient populations. I specialize in diabetes, so I work with that population quite a bit. And our hope for this evening is to just kind of provide you with the knowledge that will help you manage PCOS. So tonight we're just going to go over what is PCOS. It stands for Polycystic Ovarian Syndrome. We're going to refer to it as PCOS just because it's a lot shorter. We'll kind of walk through what hormones are involved, what normal hormone function looks like in women, and then how it differs in PCOS. And we'll discuss insulin resistance and the role that that plays in symptom management, especially when we talk about nutrition and symptom management. So we'll go over some nutrition strategies that we can implement in our daily life to kind of help manage those symptoms. We thought it would be good to, bring up some common nutrition myths, things that maybe you've heard online or seen on Instagram, and kind of debunk them a little bit, because there's not a lot of research that supports a lot of the stuff that I see online about this. So, we're going to kind of focus on that good information. And then we'll finish with some practical tools for meal planning. So, how to prep for meals, what foods to focus on, and we'll have some time for question and answers at the end. But if anyone has any questions throughout, feel free to raise your hand. I think it's helpful if it's a little bit interactive as well.
Absolutely. So I'm going to get us started with a little bit of an overview. Go to the next one. Awesome. So what is PCOS? I think it's important to have kind of a working definition that we can all work off of. So PCOS is a complex endocrine condition, and it's actually the most common endocrine condition among women of reproductive age. It affects 6 to 10% of all women. So that is a large portion of our population. It's characterized by excessive androgen hormones. So if you think about excessive facial hair, acne, hair thinning, as well as dysfunction of and polycystic ovaries, although that's not a requirement for diagnosis anymore. Blood sugar disturbances and irregularities in lipid labs are also extremely common in women with PCOS. Diagnostic criteria can vary a little bit depending on what reference point the provider is using, like what standard the provider is following. Generally, women with PCOS need to present with 2 out of 3 of the following criteria. So women need to either have absent or irregular periods, clinical or biochemical signs of hyperandrogenism, so like the acne, facial hair, excessive facial hair, hair loss as well, or polycystic ovaries as identified in an ultrasound. There have been several root causes of PCOS proposed over the years. The exact etiology, the exact known cause is unknown at this point. There's still a lot to discover, as we will dive into tonight. What we do know is that those with a first-degree relative with PCOS are considerably more likely to develop PCOS. There is a 20 to 40% prevalence for those with first-degree relatives, so that strongly suggests a genetic cause of PCOS, genetic basis. Lifestyle and diet impact, those factors strongly influence the expression of PCOS. So the severity of symptoms are often related to someone's environment and their lifestyle. We're going to spend the majority of our presentation tonight talking about those aspects, because while you don't have any control over your genes, you do have some control over individual behaviors. So we're going to talk about that. All right, so time to do a little dive into the science of hormonal regulation as well as what goes awry in PCOS. So I think this is the best way to understand PCOS is to understand non-PCOS hormonal function. So bear with me. So in PCOS, we see dysfunction in something called the hypothalamic pituitary ovarian axis. So the hypothalamus and the pituitary gland are two organs located in the brain. They, in combination with your ovaries, create a system that regulate our menstrual cycles. So during a normal menstrual cycle, there are ovarian changes, which are important for ovulation, and there are endometrial changes, which impact the uterine lining. So we're going to focus most of our attention on the ovarian cycle right now, just because it's most relevant to the symptoms of PCOS. I have some notes here so I can remember all of the specifics. But every month, the ovaries go through two phases: the follicular phase before ovulation and the luteal phase after ovulation. Menstruation, aka bleeding, itself occurs after ovulation in the endometrial cycle during the luteal phase. During that first follicular stage, the hypothalamus secretes a hormone called gonadotropin-releasing hormone, or GnRH. This hormone tells the pituitary gland to make two more hormones, which are luteinizing hormone, or LH, and follicle-stimulating hormone, FSH. LH and FSH are important because they travel to the follicles in your ovaries and bind to receptors on the follicles. Your follicles exist to protect a growing oocyte or a growing egg. And when LH and FSH bind with these receptors on the follicles, precursors for sex hormones like testosterone and estrogen are released and converted. So estradiol, a member of the estrogen family, when those levels rise in our blood as a result of that binding of those two hormones on the follicles, this tells the pituitary gland to secrete less FSH. So it's kind of a negative feedback loop. It shuts that process off or slows it down. Less FSH in the blood means there's only enough of that hormone to stimulate one follicle, which becomes dominant. And this is important for ovulation. Estradiol continues to rise in the blood. The pituitary gland starts to produce a lot of LH and FSH. There's a surge of hormones, which I swear you can feel, a day or two before ovulation. And this helps facilitate the rupture of that dominant follicle and the release of the egg. And this is ovulation. The release of the egg is ovulation. That egg then travels down the fallopian tubes into the uterus, and that begins the luteal phase. In PCOS specifically, we see a breakdown in that follicular phase with the pituitary gland releasing too much LH, too much of that luteinizing hormone. And this throws off the balance and ratio of LH to FSH. Excessive LH stimulates the production of androgens, and we see that associated with those classic PCOS symptoms. Too much LH also impairs the follicle development in the ovaries. So it interferes with the production of sex hormones. In PCOS, that surge of hormones that we see, that we need to stimulate follicle bursting and egg release and ovulation does not occur. So instead of bursting, follicles either diminish and die off, or they stay in their immature form in the ovaries, which leads to polycystic ovaries, in which we see and can confirm on ultrasound. Not every woman with PCOS has immature follicles. And that's because some of them do die off and disappear, rather than staying in that immature form. Why folks with PCOS produce too much luteinizing hormone is not well understood, unfortunately. But since a large majority of people with PCOS have insulin resistance, about 50 to 80% of people with PCOS have insulin resistance, it's thought that insulin resistance itself somehow disrupts the menstrual cycle. And we're going to spend some time talking about that tonight. So I love this little graphic here because it talks just about all the different parts of the body that are impacted by PCOS. I think that Kaitlyn and I talk about this in our practice, that sometimes you can oversimplify a topic to the point where it becomes inaccurate, right? It ends up being something that is harder to understand because you're not giving enough detail. I think oftentimes PCOS is simplified too much and you miss the broader picture of all the ways in which it affects someone's body. And a lot of this can be broken down to the impact of insulin resistance on our body, as well as that disruption in hormones. So as previously discussed, ovulation does not occur or rarely occurs in women with PCOS. ovulation triggers the release of progesterone, which is another hormone along with estrogen that regulates your menstrual cycle. That's responsible for maintaining the lining of your uterus. Without progesterone, the uterine lining doesn't shed. And so it leads to missed and irregular periods. Both of these things, both irregular periods and missed periods, can lead to infertility. PCOS is the #1 cause of inovulatory infertility in women. So it impacts many different parts of your body, and unfortunately PCOS also predisposes people to certain conditions. So the hormonal imbalance associated with PCOS, it impacts systems in our body. For example, women with PCOS are at a 10-fold increased risk of developing cardiovascular disease. And the most common risk factors for cardiovascular disease as they relate to PCOS are abnormal glucose metabolism, so impaired fasting blood sugar, prediabetes, type 2 diabetes, that's what I mean by impaired glucose metabolism, dyslipidemia or irregular lipid labs, like high bad cholesterol, high LDL cholesterol, low HDL, good cholesterol, high triglycerides. Higher weights are also associated with PCOS, and insulin resistance, metabolic disease, which is a cluster of risk factors like high blood pressure, high blood sugar, and low HDL. Some other conditions associated with PCOS, endometrial cancer, there's a higher risk of developing endometrial cancer. The risk is that irregular and missed bleeding, irregular or absent bleeding and shedding of the uterine lining leads to abnormal thickening of the uterine lining and can predispose folks to cancer and irregular abnormal cell division. There's also a condition called metabolic dysfunction associated steatic liver disease. It was previously called non-alcoholic fatty liver disease, been renamed to highlight its metabolic impacts. An increase in adipose tissue and insulin resistance can lead to fatty infiltration of the liver, so we see this more commonly in women with PCOS. Obstructive sleep apnea is also associated with PCOS. There's a higher risk for those in larger bodies of developing obstructive sleep apnea, which is also associated with PCOS, but also elevated androgens can lead to apnea through a central brain mechanism. Hypothyroidism is also really common in PCOS. It's correlated with an imbalance in the ratio of estrogen to progesterone. And then finally, last but not least, anxiety and depression rates are higher in women with PCOS. And this is multifactorial, but it's thought to have hormonal, metabolic, and inflammatory pathways. All right, so you get to hear from me a little bit longer. I'm going to continue to talk a little bit about insulin resistance. So what is insulin resistance? We're going to talk about this a lot tonight, and I think, like getting on the same page with PCOS, a definition, it's good to have a good working definition of this as well. Insulin resistance is when the cells in your liver, in your adipose tissue, and in your muscles become insensitive to insulin. So these cells become less willing to pull glucose from the bloodstream into the cells to be converted into energy. The pancreas does not give up in this situation. That keeps releasing insulin, trying into the bloodstream to try and wake up these cells that are insensitive, wake them up and help them do their job. Some people develop a condition called hyperinsulinemia, which can be determined by a blood test as a result. So, aka too much insulin in your blood at a given time. Insulin resistance causes the development of hyperinsulinemia, which contributes to metabolic abnormalities and elevated androgens as well. So you see those classic PCOS symptoms because of that. The progression of insulin resistance that we see in PCOS into something like altered glucose metabolism, like impaired fasting glucose or prediabetes, type 2 diabetes. This is a gradual process. It's not something that happens overnight. But the insulin resistance seen in PCOS, it occurs when it progresses when the pancreas can no longer keep up with demand. The thought is that since ovarian follicles have insulin receptors on them, alongside the LH receptors, excess insulin in the bloodstream binds to those insulin receptors on the follicular cells, which causes them to grow and divide. And this growing and division, more cells equal more LH receptors. And that triggers the hypothalamus, the pituitary gland to respond by generating more LH. And that more LH, again, throws off that LH-FSH balance, which prevents ovulation, and as we previously discussed. That's how they're kind of connected. So why is insulin resistance, why does it matter in PCOS? Well, it matters because of things we already talked about and the risk factors associated, but the reason that we care about this so much is because we do work with a lot of folks with type 2 diabetes, and women with PCOS are at a 2.5-fold increased risk of developing insulin resistance and a fourfold increased prevalence of type 2 diabetes. We see a fourfold increased prevalence of diabetes. What's important to note is that the International Diabetes Federation recognizes that PCOS is a non-modifiable risk factor for type 2 diabetes. So we can't reverse PCOS, it's a genetic condition, but we can improve our insulin resistance, which makes a significant difference in the risks associated with developing type 2 diabetes. And in case you are frustrated, like many women that I talk to are, about constantly being given the advice to just lose weight, right? That'll make everything go away. Despite years of trying, perhaps. Hyperinsulinemia that we talked about has been shown to be an independent risk factor for the development of type 2 diabetes in women with PCOS, independent of weight. So PCOS exists in women across the weight spectrum, and hyperinsulinemia is seen in many, regardless of their weight status. So your food and movement patterns actually mean a whole heck of a lot more than what's showing up on the scale. So that might be a little more motivating than simply being told the same thing over and over. And for most, weight is not an easily modifiable risk factor. So for example, women with PCOS have been shown to have impaired appetite regulating hormones, which can make weight management feel even more difficult than it is for the general population, like you're working against yourself in some ways. So why does nutrition matter? Well, there's a lot of misinformation, which you may have come across on the internet, about the best ways to treat PCOS, but diet and lifestyle are considered the first line approach, so that's why we care about it. 50 to 80% of women with PCOS, regardless of their body weight, experience insulin resistance. And it doesn't have to show up on your blood work as a fasting glucose that's too high or a diagnosis of diabetes for you to be experiencing insulin resistance. It really is foundational to a lot of the symptoms we were talking about. Nutrition plays a really integral role in preventing and treating the clinical manifestations of PCOS, as well as improving reproductive function. A common and annoying complaint that we hear for those with PCOS is really intense hunger, specifically for high-fat foods and those that are rich in simple carbohydrates, things like our candies, cookies, cakes, soft pretzels, Auntie Anne's calling your name from the mall, right? And diets that are high in simple carbohydrates and saturated fats tend to worsen PCOS outcomes. So we talk about in the beginning how lifestyle and environment impact the severity of symptoms. Diets that are high in these nutrients tend to make the PCOS symptoms more severe. But this can also make making healthy choices feel like an uphill battle against your own body's intuition, because these are the foods you're craving. You want to listen to your body. But with an imbalance and a lack of regulation around your hunger hormones and really intense cravings, it can feel like a losing battle. So nutrition interventions, like what we work on with you, would aim to lower circulating insulin levels, to improve insulin sensitivity, to manage any metabolic risk factors, improve blood sugar variability, right? We don't want any low lows or high highs, to reduce and to normalize food cravings, and to regulate hunger and fullness. All right, I'm going to turn it over to Kaitlyn now, and she's going to talk a little bit about some nutrition strategies.
Yeah, thank you. So, while there isn't one specific diet that's recommended for PCOS, we still have a lot that's within our control. There have been a lot of studies that looked at, like the high fat, low carb, like the keto type diets, and then the high protein, low fat type of diets. And they haven't really seen a lot of differences in terms of PCOS symptom management among the different diets. We always like to plug that there isn't a ton of research on that in general. So we do obviously need more research to kind of say for certain that is true, but there's a lot of different eating patterns that we can do that are balanced, that work for PCOS and really help reduce that risk of chronic disease. So we want to reduce that risk of developing type 2 diabetes. We want to reduce the cardiovascular risk. We want to improve ovulation. And then reduce those negative metabolic markers, things like high cholesterol. And there's a lot that we can do in nutrition to accomplish those things. So kind of the main things that we talked about focusing on are blood sugar balance. You want things that are higher in protein, moderate in carbs. You don't want to do low carb or high carb. You want to kind of stay right in the middle there. Anti-inflammatories, so anything like fruits, very colorful fruits and vegetables, those healthy fats that we've been talking about quite a bit. Hormone balancing, we'll go over this a little bit later, but some foods can help you metabolize those high hormone levels that we don't want in our bodies that make those PCOS symptoms worse. So an example of that would be like reducing testosterone levels, right? We don't want those levels to be too high because they cause that unwanted hair, facial hair, and acne. And then lastly, we want to focus on the gut supporting fibers, getting a variety of fibers, as well as probiotics, things like kimchi, sauerkraut, kombucha, all of those fermented foods that give us those probiotics. So just wanted to focus on those. And we're just going to kind of cover the tenets of a PCOS diet, because like we said, there's not one diet that we recommend over another for this. Some people have success with the lower carbs, some people have success with the higher protein. It really depends on the individual person. Working with a registered dietitian is a great way to come up with a plan that works for your individual lifestyle. We work with a lot of different folks over different lifestyles. We have some people that work third shift and their eating habits are very, very different than your average person. So we take your life and what you're able to do and kind of optimize that. And we don't just hand you like a meal plan and say, you have to do this, because that doesn't work, right? Like you can do that for like a week and then you get tired of it. If weight loss is recommended or desired, nutrition counseling can also support calorie reduction while still making sure you're getting all of those nutrients that you need every day. If you are able to exercise, it's recommended that those with PCOS get at least 150 minutes per week, 2 days of strength training as well. Again, that's highly individualized. If you're someone who doesn't exercise at all right now, you definitely want to talk to your doctor before starting and then work your way up slowly. We don't want to go from 0 to 100. You could start with 10 minutes of walking and kind of work your way up to that 150 over time. Focusing on small, frequent meals is another really important thing to help control blood sugar. Trying to get enough mixed meals. So we joke like you don't want to have lonely carbohydrates. You want to match them with protein, fat, and fiber. So like instead of eating for a snack, having just crackers, you'd want to have like crackers and cheese because you don't want those carbs to be lonely over there. So focusing on that, focusing on those mixed meals, higher protein and higher fiber in general will help slow down digestion, which will help with blood sugar balance over time as well. So if you were to think, like if you imagine drinking soda, because that is just sugar, it's going to make your blood sugars go up much faster than if you had that protein and that fat. And then again, we've hit on this quite a few times already, but focusing on those omega-3 fatty acids, making sure that you're getting enough in your diet. So we wanted to include this because this was, again, one of those things to focus on, but it is challenging to measure the anti-inflammatory effect of one single food, right? Like we're looking at dietary patterns overall. So we recommend the Mediterranean diet style pattern of eating. It's not really a diet per se, it's kind of a lifestyle, if you will. And that has a lot of anti-inflammatory benefits because of all the plants that it contains. So it's less meat, less dairy, less processed foods, and a lot more healthy options. So a lot of vegetables in there, a lot of fruits, grains, things like that, peas, lentils. It focuses on those healthy fats like the olive and the olive oil. And then there's less saturated fat in this diet, so less red meat, less processed foods, less like shelf-stable bakery goods that have that trans fat in them. And the primary sources of protein are seafood and plant-based. So again, it's just an overall anti-inflammatory diet. We can't just like pick out one food and say this is gonna like be your savior, So overall, we recommend colorful fruits and vegetables every day, trying to switch up, what colors you have each day. Making half your grains whole, so brown rice instead of white rice, whole wheat, oatmeal, rice, things like that. Small amounts of lean meat, red meat, poultry, eggs, milk, yogurt, cheese. You still have those, just in smaller amounts. And then focusing again on those heart-healthy fats. So your avocados, your olives, your olive oil, vegetable oils, nuts and seeds. Trying to add more of these foods into our daily lifestyle over time will help with that inflammation.
Do you mind if I say something too, jump in? One thing that I try to emphasize with my patients is that, and you may as well, whenever someone comes to me asking about the Mediterranean diet, I always like to add a little caveat in that the Mediterranean diet is probably one of the most highly researched dietary patterns that we have in terms of nutrition. And because of that, we have specific guidelines and food lists and all of this information. The Mediterranean diet pertains to the dietary patterns of those that surround the Mediterranean Sea, right? And there's a huge amount of ethnic and cultural diversity around the Mediterranean Sea that isn't always highlighted in the food list that you see. There are cultures around the world that their traditional dietary patterns contain foods that would easily fall within the category of many of these foods that under fruits and vegetables that might not be grown or seen traditionally around the Mediterranean, but still would have anti-inflammatory benefits. So something that we do work with people is taking into consideration their food culture and their individual just dietary patterns and preferences, and try and individualize a plan regardless. We wouldn't just give someone a meal plan saying, follow the Mediterranean diet and it will heal you. It just doesn't work that way.
So we found some PCOS power foods, and these specific foods, again, are not in their individual form going to change your life, but they all have been found to be beneficial. They all have some anti-inflammatory benefits, or they address one of those other things that we were just talking about. So maybe they're high fiber and they help with gut health supporting, or maybe their ability to balance our hormones is really strong. So there's a lot more information about this on your handout. It kind of goes over each of these foods and talks about why they are helpful in PCOS. And just if you're able to add these to your diet, if they're not already in there, it's a great way to kind of boost that anti-inflammatory response. So next we're going to talk about meal planning and kind of take everything that we just talked about into consideration and put it into practical terms, right? Because I think that's the hardest part of nutrition in general is you know what you should be doing, but it's how do I do this in my daily life? So we really liked this slide. This is from Melissa Groves Azario's book, and she is actually a local dietitian as well, and she focuses on PCOS pretty extensively. So she recommends balanced meals for PCOS. Again, this just looks like high protein, so 25 to 30 grams per meal. This is a really nice building block that you can base all your meals off of. Fat, 10 to 20 grams per meal. Fiber, 7 to 10 grams, and that will get you to that daily recommended 25 to 30 grams per day, which is very challenging for most people. I don't think the average American hits their fiber goal most days. So this is a great way to kind of get to that. And then moderate carbs, so 30 to 45 grams per meal. Obviously, this is going to vary for individuals. People who are more active or in larger bodies are probably going to need more carbs than that. If you're someone who is very active, maybe you work out more than 30 minutes a day, you're probably definitely going to need more carbs than this. So it is individual, but this is a great kind of place to start and try it out, build your meals. And then if you feel I think I need more energy, or I'm not able to lift as heavy in my workouts or whatever it may be, then you can start to kind of play around with that and bump that up. We have some example meal plans here as well. This is just a good example of what a day could look like. A lot of these recipes are, again, from her book, and she follows these building blocks as well. So all of these are going to be that higher protein, higher fiber, have that healthy fat in there. And there's a few of these recipes in your handouts as well. So you can kind of check those out and try them out, see if you like them. A lot of them are really easy to make, and just, again, it's applying that knowledge, which is really helpful. Another thing that we talk about quite a bit is meal timing. We've already mentioned this before, but what does that mean? It's really important to blood sugar management to time your meals in regular intervals. This really helps stabilize that blood sugar. It keeps your metabolism running smoothly because it kind of knows what to expect. And it helps balance those hormones too, especially your hunger and fullness hormones. If you're someone who eats kind of sporadically and skips meals, you're going to be very hungry sometimes, maybe overly full other times because you ate too much because you were so hungry. So you don't want those hormones to be like out of whack. You want to balance those as much as we can. So some strategies to kind of focus on are 3 main meals per day and 1 to 2 snacks. Trying to avoid skipping breakfast. This can lead to hunger later on in the day, even if you like have lunch, have a snack, have dinner. A lot of people still find that they're like, no, I'm ravenous by like 8 p.m. Spacing them every 3 to 4 hours is also a great kind of option, because a lot of us like eat lunch at noon and then maybe you don't make dinner till 7. That's a long time to go in between, right? And a lot of us get so busy that we don't have that snack. So really trying, if you're someone who has large amounts of time in between your meals, really try to schedule in some time for a snack in there, and it'll make a big difference. And then just limit late night snacking. It can help, or it can disrupt your sleep and your digestion if you're eating too late at night right before you go to bed. And I wanted to put this slide in here because I think it's, we talk a lot about blood sugar stability, but it's kind of like, well, what does that mean? So if you look at this slide, I know it's a little bit, the words are a little bit hard to see, but the red kind of spike there is a good example of what could happen if you had just simple carbohydrates, right? Like we had those lonely carbohydrates, we just had a Dr. Pepper. So our blood sugar went up pretty high, right? And it came back down really quickly. That spike and that coming down quickly is kind of what leads to the metabolism issues and the, like the hunger and fullness cues kind of getting messed up. So we want those spikes to be less like the Rocky Mountains and more like rolling hills is what I like to say. So in the middle there, the yellow, that one is, they're calling that one like white rice. So a little bit more sustenance there. And then the next one is like whole grains, whole veggies, that blue line. So that would be what your blood sugar would do in theory, right? Like obviously this is an oversimplification, but this is what your body would do if you did have like maybe the mixed meals with the fat and the protein and the fiber. So we want to really keep those blood sugars in between the green. Again, important to mood and energy levels overall, but will really help us avoid those really high swings in blood sugar, and that will help overall with blood sugar insulin resistance.
Can I mention one thing about that slide too that I noticed too, is that if you notice down here on this axis, it says you eat a meal 30 to 60 minutes later, 1 to 2 hours later, 3 to 4 hours later. I feel like that's really important when you're thinking about meal timing as well. We're all busy. No one wants to eat something and then feel hungry an hour later and have to stop again and eat something else and then stop again and eat something else. It would be so nice, right, if our meals that we're eating lasted longer, right? And it makes sense that every 3 to 4 hours or so, you're sort of burning through what you had at your last meal. Your body has converted that to energy, and now you need to eat again in order to refuel the tank. Yeah.
Yeah, and in comparison, like if you were to just say like have that Dr. Pepper, you're going to be hungry in an hour because your body kind of already burned through that fuel. So we've covered diet and a little bit about how to meal plan. Are any of you curious about supplements that you could add in as well? I know that's a huge topic that I hear about in PCOS. I'm seeing some people shaking their heads yes. So we thought we would talk about the really well-studied supplements that are recommended for PCOS. I know there's a lot of other information out there, but these are the ones that are really recommended throughout like the dietitian world. And obviously we like to have the obligatory plug to like talk to your doctor before. You don't want to start supplements without checking to make sure they don't interact with any of your medications or anything like that. And we always recommend focusing on getting your nutrients from food first, but we understand that that's kind of challenging. So these are great when you can't get enough nutrients from your foods. So vitamin D deficiency is actually very common in people with PCOS, as well as people in northern climates in the winter, right? So I think probably all of us in this room are a little bit vitamin D deficient because it's January in New Hampshire. But especially if you do have PCOS, you're at a higher risk of that. So vitamin D supplementation can help reduce insulin resistance and help improve lipid metabolism as well. B12 is recommended for anyone who takes metformin as a supplement. Metformin is a medication that's sometimes prescribed to people with PCOS, and it can make your body absorb B12 less efficiently. So a lot of people that are on that do end up needing this B12 supplement.
Get it tested annually.
Yes.
Already.
Yes. yeah, it's helpful if you get all of these tested as well, because the lab values can help kind of guide your doctor in how the dosing should happen. Again, we've talked a lot about the omega-3s, but getting that fish oil or flax oil, whatever your preference is, can really help improve insulin resistance and really reduce that total cholesterol. I think the average American does not get enough omega-3s, so really people see a lot of benefit when they start adding these supplements. And then the last supplement that we brought up is inositols, specifically the myo and D-chiro inositol. The recommended dose that's been studied the most is 4,000 milligrams a day. This one acts as an insulin sensitizer, so again, reduces that your body's like overproducing of that insulin, and it really does help improve a lot of the symptoms. I would say this is probably the most studied supplement that we see with PCOS, and probably one of the most effective. Some studies have noted that it's as effective as metformin, so definitely a good one to look into and see if it's something that you're interested in. And then I always just like to have a little plug at the end too, to make sure that your supplements are third-party tested. So making sure that it has like the GMP mark on it, the USP mark on it, or the NSF mark. These are third-party companies that ensure that what is on the label, what the product says is in there, is actually in there, because the FDA does not look at supplements the way they look at our food. So there are, have been instances where what is in this product is not actually what's supposed to be in there. So these companies just kind of ensure that this is a good quality product and that what is labeled on there is actually what's in there.
Beware of proprietary blends as well. There are lots of like PCOS supplements that have these blanket names to them, and they contain proprietary blends that basically gives that company carte blanche to put whatever they want to in there, and you don't get a sense of how much of something that's in there, and it can at worst do harm, or I guess, yeah, at worst do harm, at best just be completely ineffective, right? And so you end up having expensive pee, and no one wants to spend their money that way. All right, so I'm going to talk a little bit about common myths associated with PCOS. But before we jump into that, I thought I would just open it up to the group and say, what are some things you've heard about treating PCOS? What are like common things you've heard or have been told?
That I'm definitely going to get diabetes.
Okay.
Because I have PCOS.
Foregone conclusion.
Yeah.
Yeah.
And I should get on medication now,
Yeah.
no matter what.
Okay. Yeah. Anyone else heard that before? Yeah. Okay. What else have you heard?
I get lots of ads for anti-androgen medication. And
Yes.
That's like so tempting to buy into.
Yeah, absolutely.
That it's not legitimate.
I saw the other day a GLP-1 patch, like you could just absorb it. Yeah.
Oh, yeah. I've been getting ads for that for like 9 months.
Yeah, that's wild for sure. I think too that it's when you are on your own doing research, you look up something one time and then all of a sudden you have targeted ads for all of eternity. And it can be hard to separate out the noise from the legitimate things. Yeah, absolutely. What else have you heard? What other things do you think might be a myth, but you're not sure?
I have been told to do certain types of exercise, like certain exercise is a lot better than others because you don't want to put your body in too much stress.
Ah, yes. Yeah, that was something we researched in preparation for this presentation because we were like, I bet we're going to get asked this. Yes. Yeah, absolutely. That's a good one.
Are you going to talk about the exercise?
Oh, we certainly can.
Okay.
Yeah.
I was like, I want to know more, but
Yeah.
I've been told birth control might be something that needs to be started to manage the PCOS.
Yeah, definitely. Yeah. Awesome. Thank you so much. This is great. So the first myth that we're going to talk about, which wasn't mentioned, but it is something that's commonly seen on the internet, is this idea that women with PCOS should avoid gluten and dairy. Have you heard this one? Yeah? Yeah. Right. Okay. Yes. So we're going to go to the next one. So as of January 2026, there have been no randomized controlled trials, which is sort of the gold standard in research, to show a causal relationship between two different factors, that demonstrate any benefit of eliminating gluten or dairy from the diet with someone with PCOS. But so that you don't feel invalidated, if you're someone who has found success in cutting this out, I want to talk a little bit about why these recommendations are commonly made. So while there are no formal guidelines on how much dairy or gluten women with PCOS should have, or whether it's necessary to eliminate from their diet altogether, when it comes to dairy, some types of dairy contain growth stimulating hormones, and that stimulates an insulin-like growth factor, which can result in a higher risk for hyperinsulinemia. So it can increase the amount of insulin in your bloodstream, which can then worsen hyperandrogenism. So it can worsen acne and hair growth, et cetera. There's often been a link between dairy and acne. I have patients who come to me to figure out ways to increase the calcium, vitamin D in their diet because they've cut out all dairy because they've been told it would help cure their cystic acne. There have been no scientific studies showing a positive relationship between those two things, but anecdotally, it's a very common thing that I hear. It may be advisable for the reasons stated previously that women with PCOS limit their dairy intake to 2 or less servings per day, simply for the increased risk of hyperandrogenism. That is if they are consuming dairy products that have those growth stimulating hormones. You'll see one that's like made without or produced without RHGB or RHGH. Yeah, I have to look at the specific acronym, in which case you would be less of a risk factor. Adult women need about 1,000 milligrams of calcium per day. There are other ways to get calcium besides dairy products. This is higher in growing kids. But other ways besides dairy products would be like almond, hemp, coconut or rice milk. Certain vegetables like broccoli, kale, and bok choy are also really good sources of calcium. 5 ounces of salmon contains more calcium than a glass of milk. So it's something to think about too, since there are lots of other benefits to seafood and specifically salmon. Seeds like chia seeds, sesame seeds, flax seeds are also a source of calcium. Despite the internet's growing sort of showing the popularity of gluten-free and dairy-free diets for PCOS, there aren't any evidence-based studies looking at the efficacy of removing those things completely from your diet. However, it is very common for people that do cut out gluten from their diet to consume overall less caloric intake, have a lower caloric intake, and less carbohydrate intake. And so there can be some ripple effects, positive ripple effects of removing gluten from your diet. Kaitlyn mentioned this the other day, and I've been saying it on repeat to patients, is that nutrition is about 90% behavior. So sometimes you make a decision about making a particular change, and it's not the food itself or the elimination of the food that's most helpful, because there's no causal relationship between gluten and PCOS symptoms, but it makes it so you're eating less cookies and you are eating more low glycemic foods like non-starchy vegetables. And so that can improve the symptoms of PCOS. Gluten-free diets in particular are not necessarily more nutrient dense. In some ways they can be less nutrient dense. So it is important to work with a dietitian if you're considering eliminating these foods from your diet, since so many foods contain them. We want to make sure you're not missing out on any key nutrients, even if you do decide, which is totally your prerogative to do so. But if you decide to work with someone that can guide you. All right, myth number 2, birth controls are the only available medical treatment for PCOS available. Who's heard this or thinks this? Maybe. Yeah.
Yeah, a lot of people get told this, right?
Yeah,
Yeah.
absolutely.
Sorry. I was gonna say, and then you're like in a black hole when you're ready to start fertility planning.
Yes.
Yeah.
Mm-hmm.
Yeah.
Yeah, 100%.
Yeah, a lot of women get told, come back when you want to get pregnant, right? And then
Yeah.
explaining
Right.
all of this and working with you, yeah.
And I work with pediatric patients who have PCOS, and it's like, dude, I'm 15. Like, I don't, like this, are you going to help me before then? I have like maybe 10 years before I want to even have this conversation with an adult. Yeah. So birth control represents one way to manage PCOS. And I do want to clarify what birth control pills do for a woman with PCOS, because I don't think it's well explained. And I think that whenever a doctor or a provider recommends something but doesn't explain it, it's easy to feel suspicious of that recommendation, because it just feels like this blanket recommendation, like it's going to cure everything, and it won't, right? It won't. And medical management alone doesn't cure PCOS because it's a chronic condition. It's not reversible. There are other medical treatments available for PCOS that sometimes, it's often the women with PCOS that are telling their provider, hey, I want to try this. I heard about this. What do you think? So we can go to, oh, never mind. I have other things to talk about on this slide. So oral contraceptives are used to manage PCOS because the doses of estrogen that are taken suppress FSH, so follicle stimulating hormone, and LH. So they induce regular periods. It allows you to have more regular periods. The estrogen also increases a hormone in your liver called SHGB, which binds to free testosterone that is floating around in your bloodstream, making it unavailable for tissues. So this can dramatically improve things like acne and excessive hair growth, hair loss, because that testosterone is no longer available. That testosterone is an androgen, which would then lead to those signs and symptoms, biochemical and clinical signs of hyperandrogenism. So oral birth control, has its own risks, and like you said, you can get in this like black hole of fertility and medications for your PCOS, and there are other medications that are not indicated for when you are trying to get pregnant, and so it can be difficult to find the balance between those two things. I will often recommend that if a person is interested in improving their reproductive function because they want to have a baby soon, but they also have PCOS, to meet with a reproductive endocrinologist instead of just a normal endocrinologist or a normal OBGYN, because they really work at the intersection of those two things. It can be challenging to find one around here, but I know some, so you can talk to me if you need to. So, talk to your doctor before you consider anything like this. Spironolactone is a medication that is often prescribed to women with PCOS as well. It is a weak antihypertensive, so a weak blood pressure medication, but it effectively treats excessive hair growth and hair loss. It's an androgen blocker, so it is one of the known androgen blockers. It competes for testosterone at androgen receptors on the cells. So it makes it so those androgens can't latch on, can't bind with the receptors as readily. It can take anywhere between 3 and 6 months to begin seeing the positive impacts of this medication. So if you're on it, don't give up, because it can take some time to see the benefits. Much like many hair loss remedies, it takes 3 to 6 months to start seeing any kind of benefit. People usually quit before then. This is a medication, spironolactone. It should not be taken if you're trying to get pregnant because it can harm a growing fetus. Metformin, we've talked about this before. Metformin is commonly prescribed to women with PCOS because it is an insulin sensitizer, like inositols. So it works by suppressing the creation of glucose in the body. So a fancy word is gluconeogenesis. So your body making glucose with its own stores and tissues. So it also increases the liver and the muscles cells' sensitivity and receptivity to insulin, and it decreases carbohydrate absorption as well. So ultimately it helps to reduce circulating insulin levels, which can then improve signs and symptoms of hyperandrogenism and risks associated with insulin resistance. Metformin is really good at inducing ovulation, to the point where even if you've never been on birth control, doctors will recommend that you get on birth control if you don't want to get pregnant, because it is very good at that. There are some side effects to metformin. They most commonly occur in the beginning, first 2 to 3 weeks when you're taking it. These are lessened if you have an extended release version of the medication. Common symptoms include nausea, bloating, diarrhea. They tend to subside. They get worse at higher doses. But talk to your doctor about specifically titrating up. GLP-1 receptor agonists are all the rage and very much part of the conversation on weight management right now. They can be really effective in women with PCOS because they can really improve insulin sensitivity. And they can help with weight loss, obviously, as well. Metformin can help with weight loss as well. It's not always effective until it's at a higher dose. But when metformin is not effective on its own, GLP-1s can be introduced. GLP-1s are also associated with GI side effects. And so that titration, the slow increasing of dose, is very important. It's super important that you have really good supervision by a medical provider if you ever started on GLP-1, and that you work with a dietitian, because you are at a higher risk of muscle atrophy on a GLP-1, but they're extremely effective in helping to reduce insulin, increasing insulin sensitivity, and thus improving PCOS symptoms. All right, myth 3. I can only be healthy if I cook everything from scratch. I hear this every day, and I see this look in people's eyes of like, I know this is what I need, but it's never going to happen. But can you please help me have it happen, right? Please let me, have it happen, whatever. So you go back one, sorry. So there are nutrient-dense convenience foods that can help reduce meal prep and planning. And the ones that I talk to most frequently with people are those less processed convenience foods. So things like canned and packaged beans and lentils, frozen fruits and vegetables, rice, mixed dishes, pre-cut vegetables and fruit. My gosh, you're always going to pay a little bit more when someone does the labor for you, but sometimes it's worth it for the offset of time. Stir fry mixes, salad kits, packaged nuts and seeds, nut butters, seed butters, sliced bread, whole grain crackers, yogurt, cottage cheese. These are all convenience foods. They're all processed in some way, but they can really help simplify meal planning and meal prep. So by leveraging convenience foods, we can have better management of our PCOS and don't have to resort to the untenable expectation of having to cook everything from scratch or perfectly bentoed box meals, right? So it isn't necessary to prepare all your meals from scratch. This is coming from 2 dietitians that love to cook, but you don't have to every night. If it is Wednesday at 6 p.m. and I haven't thought about dinner, takeout is happening, right? It is happening because it's just such an impossible lift some nights. So there's a berry crisp recipe in this book in particular, that asks for 1 cup of strawberries, 1 cup of raspberries, 1 cup of blackberries, 1 cup of blueberries. This could easily be modified with 4 cups of mixed berries, right? One of those jumbo bags of mixed berries, frozen mixed berries, making that recipe very simple. If you're making a burrito bowl, you could saute up pre-cut peppers and onions from the frozen food section. And since frozen fruits and vegetables are blanched before they're frozen, some of that cooking process already happens. They're going to cook up way faster. Despite the water content, which you can burn off in a saute with a little bit of oil and salt and pepper, you can get really good browning by roasting frozen vegetables and by sauteing them as well. So you're still going to get that flavor even if it's not from fresh, and cuts down the labor significantly. If something says cut an onion, it's automatically not an easy recipe, in my opinion. So purchasing a high-protein Greek yogurt can be a really excellent replacement for protein powder in anything. So there are smoothie recipes and muffin recipes in here that ask for protein powder. A high-protein Greek yogurt is a much more accessible ingredient, in my opinion. In muffins, you might need to increase the dry ingredients in the recipe to offset some of the moisture from the yogurt, but they're producing high-protein Greek yogurts right now that have up to 30 grams per cup of yogurt. So it really is a great option, and cheaper sometimes than a big jug of whey powder, and more delicious. And utilizing pre-cooked, grilled, or roasted proteins like chicken is a really great way to have a quick protein in your diet. And you're trying to increase the protein in your diet. You don't have to do everything at once. It can be thrown into pasta dishes, on salads and casseroles, stir fries. Like any kind of deli meat, pre-prepared proteins that are pre-cooked like this, they're going to have more sodium. So just take that into consideration. All right, Kaitlyn is now going to walk us through some more practical tools for successful management of PCOS.
Yeah, so this just, again, as Whitney was just kind of talking about, meal planning for busy lives. How can we make easy meals that focus on the building blocks, again, that we mentioned earlier, while still, having time to do other things in our life, right? So for meal planning, we really want to focus on what are you going to be able to do for the week, and what does your week look like? Are you going away this weekend and you're not going to be home, so you don't need to buy as much food. So plan out what you want to do for the week. Take inventory of what you already have in the kitchen. I'm very guilty of this. Sometimes I buy like 3 of the same thing, even though I already had it, so I should have just checked. And just sit down and look at the recipes and make a list of what you need from the store, and then do the shopping. You can do it online, you can do it in the store. And a lot of people do meal prep in different ways. So you can prep everything, you can prep just the sides. A good example would be you could prep all your proteins for the week, right? Those are the things that kind of take longer, and then just make the sides quickly each day as you go out throughout the week. And if this is something that you've never done, you've never done like a big meal prep, start with one meal to build confidence and kind of work your way up from there. You don't need to meal prep every single thing you eat, but it does make a big difference if you have some stuff ready, especially like if you're leaving work, at 7 o'clock and you're like, well, there's nothing in my fridge, so yeah, I'm gonna get takeout. Whereas if you have some stuff there, like mentally, you're much more likely to go home and actually do that.
Yeah. One thing I tell people too is that pre-washing your grapes and putting them in baggies is meal prep. Stuffing granola bars into your glove box is meal prep. Meal prep is all about making healthy food more accessible to you. So whatever that looks like, that's what it's going to be.
It doesn't have to be complicated. It doesn't have to be the aesthetic, meal prep in all the glass containers. You can just use your normal Tupperware and just stick it in the fridge as long as it's stored effectively. It's really the only thing that matters, right? When we talk about dining out, a lot of people recommend, planning ahead, taking a look at that menu ahead of time, looking for those PCOS-friendly meals, things like grilled, baked, steamed over fried. This also depends on how often you go out to eat, right? Like if you're someone who goes out to eat less than once a week, it's not as important to really focus on what you're getting because your overall dietary pattern is probably still pretty good if you're eating a lot of your meals at home. If you're going out daily, or maybe every other day, that's the time when you really would want to look a little bit closer at what you're ordering and does it fit into those kind of building blocks we talked about earlier. Obviously for special occasions, like if you're going out for your birthday, get the cake. You're going to be ordering dessert, but just look at that overall pattern overall. And if something changes in your life and you're going out a lot all of a sudden, just keep that in mind that as the frequency increases, we really want to be looking at that a little closer. And the last thing that we really like to work with people on is goal setting. So making small changes to your everyday life will lead to long-term success. So if you're sitting here and you've got a lot of good ideas, don't try and implement them all at once, right? Like start with one. Maybe you want to increase that HDL cholesterol. That's your good cholesterol. That's the one you want to be higher. Maybe you got it back and it was 30 and I think they want it to be 40 or over. So you could start by incorporating a little bit more physical activity into your week, introducing those foods with those high omega-3 fatty acids in the form of a supplement. It doesn't have to be complicated, and then that will lead to those changes. Another good one that we've really hammered home, I think, here is lowering those circular insulin levels. Replacing that breakfast cereal maybe 3 times a week with a yogurt parfait that has some fruit in there, has some chia seeds. So you're getting more protein, more fiber, getting a lot less of just those simple carbohydrates. Another thing could be to add some non-starchy veggies at lunch and dinner, especially if it's something that you're not doing right now. So just little ways to kind of create these habits that we've discussed throughout this presentation. And then lastly, if your goal is to reduce sugar cravings and that feeling of being out of control around food, especially with hormones, we see that later on in the evening, trying to have a bigger portion at breakfast, front load that protein intake throughout the day so that you're not getting hungry. Like I talked about before, having that balanced snack between lunch and dinner so you're not going, all of those hours without eating.
One thing I wanted to mention too is that when I work with patients, and I'm sure Kaitlyn, you see this too, people often come in and say, my goal is blank. And what they're actually saying is that my long-term goal, what I want to do, what I want to achieve, who I want to be, that's an outcome, right? That's the outcome I want to achieve. But it's harder to think about the daily, weekly, monthly habits that are necessary to achieve that outcome. And so in that slide before, you mind going back just one? The bolded, these are really the outcomes, right? Overall, I would really like to see my HDL come down or go up. I really want to lower those circulating insulin levels. So I just got my labs back and it's real high, so I know I have insulin resistance, or man, I really wish I didn't feel so out of control around food. That is the outcome. These are the goals. The goals are measurable. They're time bound. They are hopefully relevant, right? They're specific. The more specificity that you can have, that's something that we can say between session 1 working with you and session 5, it was accomplished or not. So yeah, I wanted to mention that. And with that in mind, if you are sitting here going, hey, they've really made a solid case for working with a dietitian and you want to work with us one-on-one to create a more individualized plan, we would so welcome that. We love working with women with PCOS. You can ask your provider for a nutrition referral. Our staff will check your insurance coverage and call to schedule an appointment. Generally, commercial insurance covers nutrition counseling for PCOS and typically pretty well. So that's something to consider. Depending on your preference and need, we will often schedule an initial session of about 60 minutes and then follow-up session or sessions for 30-minute sessions. And yeah, if you have any other questions, you can reach out to our department.
Yeah. And I know we're out of time, but if anyone wants to stick around for questions, we'd be happy to answer any of your questions or kind of talk through Again, maybe some more myths that you guys have heard.
Yeah, feel free to come up to us afterwards. We'll be hanging out here for a few minutes if you have any specific questions. Yeah.
Name of that book, though.
Oh, yeah. We'll put it out there. So it's A Balanced Approach to PCOS. And I will say it's mostly recipes, but she kind of shows a way to include those PCS power foods into meals. It's also organized seasonally, which is kind of cool. So like winter, spring, you know what the seasons are. Yeah, so it's organized that way. And yeah, she's based in Keene, so it's pretty cool.
What's the author's name?
The author is Melissa Groves Azzaro, Azzaro. Yeah. I think her handle is the hormone dietitian on Instagram too, if you follow her. This feels kind of like a cross promotion of her business, this presentation. It's just, when you find a good PCOS resource, like you hang on to it, right? Because some of the information out there is like not good. So it's nice to find good things. Yeah. Thank you all so much for coming out on this really chilly night. Sunday's a great time. Saturday would be a great time to put some of this into action and plan your snow day, meals and grocery shop with everyone else and their brother. These are some ongoing resources for support. So we really like the PCOS Nutrition Center, the Androgen Excess and PCOS Society, the Polycystic Ovary Association, and PCOS Challenge. These slides will be made available online, and so will the presentation.
Yeah, the video will be on
video will be
YouTube.
online.
Yep. Or our MCH's website as well.
Yeah.
So yeah, if you have someone who couldn't make it tonight, you can forward that along to them.
Yeah.